Are you someone who experiences a lot of one-sided low back stiffness or even pain? Your quadratus lumborum, aka your QL muscle, may be your problem. In this video, I'm going to show you a simple and effective routine to not only loosen up your QL muscle, but also strengthen it so we can hold on to long-lasting results using my proven functional mobility formula. This formula is going to show you a comprehensive rehab strategy for your QL muscle and can also be used for any other muscle, joint, or even nerve issue. So let's dive in. So the first R in the functional mobility formula is recognize. So we want to do two things here. First, recognize where your symptoms are. So if you have a QL muscle problem, it's usually one-sided, and that muscle spans between the top of your pelvis to the bottom of your rib cage, right in this flank area. So do you have a lot of pain or tension in that area? If so, your QL muscle might be your problem. But secondarily, we want to recognize a couple movements or postures that cause your symptoms. So a couple easy ones would be just reaching for your toes. Do you feel a lot of symptoms there? Or say my symptoms are on my left side. If I side bend towards my right, do I feel a big pull or does it even tug at my pain? Once we recognize where our symptoms are and collect a couple baseline movements, then we want to move on to the next step. The second R is reduce tension. So I'm going to show you a simple and effective way to loosen up that QL muscle tension. So what we're going to do is start in this quadruped position, and then we're going to rock back into what we call a child's pose. And from this position, we're just going to think about breathing into our backside here. Breathe in through the nose, out through the mouth. And if you can tolerate it, as you breathe out, you can start to reach overhead to really elongate this area. Now this is level one. To take it up to the next level, you would side bend away. So if I'm wanting to stretch out my left QL, I would side bend at about a 45-degree angle to my right here. And as I breathe in, I'm trying to breathe into the tension I feel on this side. And as I breathe out, reaching further across, I'm gonna do a solid 10 to 15 breaths here. From the other angle, I'm going to rock back, reach overhead, side bend away, breathe in, breathe out. As I reach, and I'm really trying to expand and open up this left side. And if both sides are tight, don't discriminate. You can work into that right side as well. And then we're going to move on to the next step. So after reducing the tension, next we want to restore the joint range of motion. So for this next move, we're just going to be doing some lateral flexions or side bends. And I'm going to do it from this kneeling position. So I'm going to hug my shoulders here, and then we're going to slowly side bend our spine, trying to move one vertebra at a time until we run out of real estate or I just get a ton of opening angle tension on that opposite side. And then we're going to slowly upright, again trying to work or move one segment at a time. This is really going to help us train our intersegmental mobility. And then for me, I have more tension on that left side. So as soon as I hit that opening angle tension, I smooch it, and then we just work on to the other side. From the back, we're just going to slowly side bend. I'm thinking from the top of my thoracic segments down to my lower thoracic segments here. Once I run out of real estate, then we try to work from the bottom up until we're back in that upright position, and then use that momentum to swing it to the other side. And as you rep this out, you're trying to see if you can go further and further. So I still feel more tension on this left side. Again, smooch it, come right back, and you're gonna do a solid 5 to 10 of these on each side. Once we regain some mobility, then we're ready for the next step. The final R in the functional mobility formula is reinforce. So the next step, we're going to reinforce the changes we just made with a strength and stability exercise. So to help work the QL, we're going to do a classic core exercise here, but we're going to use it more for the QL muscle, and that's just a side plank. So if I'm starting from the sideline position, I come up to my forearm, pack my shoulder tight, and then I'm going to put my top foot right in front of the other, and I'm going to come up into that side plank. So level one would just be holding this for 30 to 60 seconds. But to take this up another level, we're gonna do some dips here. So to make this more dynamic, I'm gonna think about touching the floor with my waistband, just kind of hovering above it until I run out of real estate. And then I bring it up to the top here. And I'm just gonna slowly dip down, trying to control that range as much as possible. So not only do I feel my overall core working here, but I really feel that bottom side QL working. I'm gonna do a solid 5 to 10 reps here, or until I feel like I'm fatiguing. If you feel any pain or discomfort while doing this, we say just go to that fatigue failure. Don't keep pushing through it because it's only gonna make things worse. Then it never hurts to do the other side. So luckily you have two sides because you can compare the two. So on this side, I'm already about 5 or 6 reps in, and I don't feel this bottom side QL fatiguing as much, so we know we really got to strengthen that left side if we want to overcome this QL issue. After this final move, there is a bonus step we want to do next. And that bonus step, or that bonus R, is reassess. So how do we know if this is helpful for you? Well, at the beginning, we recognized our symptoms, but also a couple baseline movements. So first, just after completing the routine, how do your symptoms feel? Do you have less tension or even pain in this area? If so, then you know this is a really good routine for you. But more important than your symptoms, did it improve your function? So if we collected those baseline movements, for instance, just reaching for the toes, if you can go further before you feel that, or you can go all the way without feeling it, or now you could side bend and open up this space with no pain or issue, then you really know this routine is good for you. Improving symptoms is important, but if you don't improve the function, it's only a matter of time before those symptoms keep repeating themselves and you get stuck in that perpetual pain cycle. From my experience rehabbing patients all day, as you improve the function, the symptoms might not follow at a 1-to-1 ratio, but if you continue to move better and you could do more without causing your symptoms, eventually it's going to catch up and you're going to move better and feel better at the same time. Now, if this functional mobility formula makes sense to you, this is how I rehab every single one of my patients, regardless of what muscle, joint, or nerve issue they may have. So if you have a request or you want to see something specific, leave it in the comments below and get moving.